Today, physicians are so busy that they really don't have time to go into details with their patients. The aspect of prevention is really missing in the medical world. One of the biggest thing I need to do is to educate my patients. I want to get involved more in everything else so I can help the world at large, not just dentistry.
Good day, everyone. This is Dr. David Phelps of the Freedom Founders Mastermind Community and Dentist Freedom Blueprint Podcast. Today, I'm just really privileged and honored to be able to interview our guest today, which is Dr. Hiru Mathur. Hiru, how are you?
I'm doing great. Thank you, David.
The reason I want to have Hiru here today, Hiru is a Houston periodontist. We'll talk a little bit more about her story and her practice, but she's also a member of our community, Freedom Founders. She and her husband, Sumit, been members for almost 2 years, I think, coming up here this summer. And we've just enjoyed so much watching your growth, Hiru, with the iterations that you've made. I think starting with the way you think about your life, your practice, your family, and obviously some of the big things that came out of COVID last year. One thing we're going to talk about that came out of COVID last year will be our topic today. But also just your leadership in the industry as a whole, in your dental community, and also in Freedom Founders. And really, it's what I think in terms of when I talk about the 5 freedoms. It's going up that pyramid and not ever staying stuck, but realizing that we all have additional passions and talents, and we can integrate those into the actual clinical training that we start out with in life. In this case, a dentist or specialist, as you are. That's where we got started, right? And that's kind of who we are in our identity, and we go to do that and learn well and take CE to do that well. But there can be other iterations of that, other ways that you can also add value that can change the routine of your life as well. And I think that's what you're blossoming into, even though you were doing that before you came to Freedom Founders, for sure. It was already in your heart, and I think you just embellished that. So without going further, we're going to talk about today in particular the book that Dr. Mathur authored and published this year. The title is "It's All About the Gums, the Mouth and Body Connection." And Hiru, let's talk about first why you decided to write the book. Why did you decide to do it?
Okay. Firstly, I want to thank you, David. I'm glad to be here. So as a periodontist, I see a lot of patients with chronic gum disease, and most of them whose disease is severe or keeps coming back, they seem to have some kind of a systemic problem, which most of us know in dentistry. But unfortunately, I was surprised to see that most patients didn't know. And also, I was also surprised that most of their physicians were not in the know of this whole problem that we have. We all know that inflammation today is causing every disease, every cancer that we are aware of. And the biggest source of inflammation today is the gut, which is our digestive system, but also the mouth. And in periodontal disease, those bacteria are constantly causing inflammation, constantly affecting the rest of the body, but somehow most people just seem to be unaware of it. So my goal was, what I feel as a caregiver, one of the biggest thing I need to do is to educate my patients to make sure they understand what is causing the problems that they have and how they can be empowered with that knowledge and even discuss with their physicians and hopefully prevent some major issues like diabetes and heart disease. So I thought this book would give them an easy to read guide. And I was hoping the dentists and hygienists can hand it over to all their perio patients so they can better control not just their gum disease, but even the rest of their health.
So obviously there's lots of ways that we can attempt to educate our patients. And, on site in the practice, your hygienist, your well-trained staff all have a part of that, right? But what is it about, do you think, now that your book's out? It's been out for a few months, but what do you think that doing it in the form of actually a book that you have now authored, what else does that add to the element of your ability to educate the patients, and as you said, also the medical community at large?
I think what I've noticed with my patients is that they look at me as an expert a little bit more than they used to. And so many of them seek me out now after looking at the book because they feel like I'm interested in their overall wellness. So it's really helped me send the message across in a much more powerful way than I would do by just talking to them. And I feel I'm reaching out to more people who are not even my patients. A lot of my colleagues are happy because their patients look at the book. Many times my colleagues are not able to explain in detail like we would. So they hand them the book and they look at the book and they understand what's going on. So it makes it a lot easier, even for my colleagues who work with me. Lastly, I think for my staff, I feel it makes them feel very validated, like they work in a practice where we believe in very excellent care for our patients, and then writing it down just gives them more information as well. So they can actually, they all read the book and now they feel like they know even a lot more than they did before because it's very clearly outlined for them to understand it easily.
Yeah, the credibility and additional authority positioning that it gives you as the author, you're right. I think it enhances that that your communication that you, well, it differentiates you and your practice, as you said, and your staff. Number one, they've got to be proud of the fact that the doctor that they work with is a published author, and it also, I think, decommoditizes what unfortunately a lot of healthcare can become, and dentistry is not ruled out. It's, people think of, well, you know, I go get my teeth, you know, drilled and filled and crowned, or, you know, I go to the periodontist because my dentist told me I have, quote, gum disease. Well, it doesn't hurt, you know, and what's a little bit of bleeding here and there, it does, you know, doesn't seem to be causing me a problem. And now you have established the fact that there's more to that. And if people who care about their health, and you know, the majority of people today's you know, do care about their health, they realize that they have to take it in their own hands. We can't play the Western medicine of, well, we've got a drug or an antibiotic for everything that will just fix it. No, I think most people, the majority, are starting to think, you know, I can take more in my own hands. Now you've created a communication that says it's not just about going in and having your teeth cleaned every 6 months. I mean, you know, it's like, I need a professional to actually help evaluate, because there's so many other aspects that could be affecting my health that I don't even know. And my doctor, who's trying to treat me with XYZ, doesn't know. And all of a sudden there's this connection that maybe now I'm taking more control over my future. And I can, and your patient, you know, your patient can take this to their doctor, as you said,
yes,
you know, and say, you know, and they might, you bet you've had these conversations. Patient says, really? I've been going to see my physician, and we've been dealing with this, and I wonder if there's a connection there. And right, does that happen?
Amazing. It's amazing how many of them are not aware at all. I have some patients who are severe diabetics and they keep coming back with gum disease. And when I explain to them that connection, they get the shock, like they get the biggest shock ever. They're surprised that there's a connection. And so I wish, I think today physicians are so busy that they really don't have time to go into details with their patients. And I think the aspect of prevention is really missing in the medical world, where they can actually sit down and say, okay, I'm not just going to throw these prescriptions in your face, but I'm going to actually explain to you how you can actually cut down your medications and how you can prevent it from getting worse. But really, there's no time. Most of them are rushing. So I feel like as dentists, we have so much more time with our patients. My hygienist has a lot of time with the patients. So if we can take that responsibility where we can explain, yes, we cannot take the place of the medical doctor, but we surely can explain the connection. And so the patients with that knowledge, they can go ask their physician and actually ask for answers and hopefully not go into any severe conditions that they are suffering from.
You've got a very busy practice. You've got several associates, I think, looking to bring on another one. So things are working well for you because you do provide great service, and you have created a culture and team around you that, no doubt, that the experience people get, they're going to come back, they're going to refer their friends to you. You've been in a place where you actually, you love to teach, you love to do, but you also love to teach. It's in you. You've been a professor, a clinical professor. You do other courses, right, for colleagues. You've been doing this for several decades, really, right?
Yes, for over 20 years. Yes,
over 20 years.
Yes.
So your ability to communicate to either your colleagues, professionals, or your patients, you know, lay people, has really been part of you all along. So this is just enhancing that. This book is enhancing what was already within you. And I'm curious, do you obviously patients can get this book from your practice. Do you give patients extra ones to give out to their friends or family or other people? I mean, is that part of getting the word out to try to get the book in as many hands as you can?
Yes, I do. So I have been actually giving it to my patients, and some of them actually ordering it for their family members. And I've actually have some patients who their daughters want to go to dental school because they came and met me. So they are so excited. So they are buying books for them as graduation presents. So it's pretty cool to see the enthusiasm from the patients. They're all very excited about it. So yes, we've been giving away I mean, a lot of them are ordering from Amazon, but they can also get it from our office.
Well, you know, you're such a great role model. I mean, certainly as a specialist in dentistry, but again, I think as a female role model for our young women today who aspire to be whatever they want to be. But I think we've broken that barrier of can women do what they want to do? Absolutely, they can. Absolutely, just
Yes.
don't set a limit on what you want to do. And I think it's great that you can carry that torch as well. For young people that want to follow in similar footsteps, I should say. Maybe it doesn't have to be the same, but similar. They go, I could be this too, because look at my dentist or my periodontist or my mother's periodontist or whatever it might be, right?
Yes, it's really cool to see that.
Yeah.
It's very nice.
Talk about actually sitting down to write a book. For most people, I think that may be something I'd love to write a book, but my goodness, how do you start? I mean, how did you go about it? Because you started doing this back a year ago when a lot of the world and certainly health practices, dental practices were in that shutdown mode for several months. Is that when you started it, during that downtime?
Yes. So see, David, I always wanted to write a book. And if you remember when I talked to you and Candace in 2019, I mentioned that I want to write a book. So I feel like everything comes out of a desire.
Yeah.
And then you need to have some resources, and then you need to have time. So I always had the desire, but I didn't really have the resources. And then I remember talking to you, and both of you gave me a lot of guidance and also some resources I could talk to get working on the book. And so I was armed with all that, but I still didn't have the time. And then, of course, during the lockdown, during COVID, when we shut down, I was amazed. I had the most time I ever had in decades. So I was like, okay, here's my chance. I can sit down and put everything down in writing, which has been buzzing in my brains for so long. So I sat down and wrote everything down, and eventually, by the end of the year, got it edited and then published early this year. So it was a process, but COVID really helped me. I mean, that time was fantastic. I could just peacefully sit down and put everything together.
It's interesting how sometimes events in our lives that we don't plan on, that come out of the blue, kind of blindside us, like COVID certainly did,
So
but
true.
how those events can turn into new opportunities. We don't see them at the time. Obviously everybody was scrambling back during COVID, literally scrambling for health reasons and for business reasons and everything else. But you had the wherewithal to say, hey, I can control what I can control. I can't control the timing and going back to practice. I've got time now to do something else. And you had it already, on your dream list of something
Correct.
that was there, and you stepped right out and made it happen. Have there been any other side benefits that have come from doing the book that we haven't already talked about? Anything else that like, I didn't know that was going to happen? Anything?
I think another good thing that has happened is my kids are so proud of me. So my sons, they keep telling all their friends, and they have, in fact, now my older son is starting to write a book because he's so excited that it's possible. I think I have shown most of my family members, at least, that you can do it, because I'm the first one to publish a book in my family. So now I think I've created that path for everyone to believe that, hey, we can all do it. So that's very empowering to see the positive influence, not just on your patients, but also your family and loved ones. It's been really fulfilling.
Do you think you might have another book in you at some point?
Absolutely. I'm already thinking of that. My goal was to write several books. So this was my first one that paved the path. And and I'm already thinking of my next idea.
Yeah, that's great. So that's the next idea for a book, and I can't wait to see that one. What about for you, as the person you are, the professional you are, mother that you are, spouse that you are? What do you think is next for you on a bigger plane? You're not thinking about like retirement or anything, but where do you think you kind of want to go with what you've already done? What would be a next step for you, that if you could just kind of wave that wand and say, in 2 years, 3 years, I'd like to be doing this? How would your life and practice style change, if at all?
So I love what I do way too much. So I know I won't retire for a long time. But yes, I would like to cut down my clinical practice, but I don't think I'll ever stop doing it in the near future. But with my associates in place, if I can get more time, write some more books, and hopefully speak some more. And also, I would like to actually um, um, get more involved in some charities and a little bit more social work, which I feel like I don't physically do. I do more in terms of, financial support. So I think I want to be more involved in charities and just help my environment and the social situation around me. And besides that, one of my favorite things to do is to travel. So I would love to probably go to Italy for a few months and learn Italian. And so I have a lot of other things that I want to do too, besides dentistry, for sure.
Well, Hiru, book authors need to travel to add to their stories for their books and
There you go.
additional. So there's an aspect of that I think you need to do that. So if
Absolutely.
for sure. So, well, listen, so great to talk to you today, to talk about the book, to talk about so much that you've done in your life and how you still aspire and inspire other people to also look at their lives and say, hey, there's more that we can do. There's more that we can be if we just open the door and explore these frontiers that we all have in front of us. And sometimes life just seems to like shuts things down and you feel like, gosh, I'm just stuck here. It's like, it doesn't have to be that way. And you're certainly a role model for that attitude and that mindset. So I just want to thank you for being such a great contributor to Freedom Founders and a great contributor to your patients, your staff, your community, and our colleagues. Just super. Dr. Hiru Mathur.
Thank you, David.
So much.
I want to thank you for setting me on that path. Freedom Founders has really helped me just define what I want more clearly and reach it. So thank you so much. Bye.